Afternoon, everybody, and welcome back to the PROMS conference. Hope you all had a good morning, and thank you to the people that attended the UK SIG this morning. It was a really great session. My name's John Evans. For those that don't know me, I'm an orthopaedic surgeon and a PROMS researcher, and I do that because quantifying how my patients do is really the most important part of my practice, and I think it's something we're all in alignment and in agreement with. Gareth, if you could pop my slides up for me, please. So the first thing I do want to make you all aware of this morning is that unfortunately Liz O'Riordan, who was due to be our speaker at just after this opening remarks session, is going to be unable to join us. So we're going to give you a slightly longer break before the breakout sessions begin. We'd encourage you all to take that opportunity to grab a cup of coffee and have a look at the poster sessions which are available on the Google Drive. Okay, let's proceed with the slides. So I really want to extend my thanks, first of all, to the Welsh Value and Health team for organising this conference. I thought yesterday went incredibly well. They've put in an enormous amount of effort over the last few months to get this on board. And I think the fact that this is a free conference is fantastic as well. I think the attendance has been wonderful, and it does seem that this conference just grows year on year, and it's really fantastic. So thank you so much to them. Next slide, please. So this is my favourite slide. I put it in lots of my presentations, that without data you're just another person with an opinion. This is William Edwards Denning, who's widely acknowledged to be a leading management thinker in the field of quality. He's a statistician by trade and a business consultant whose methods really helped hasten Japan's recovery after the Second World War. And it's all about the data, really, isn't it? I think particularly as surgeons, we are really we struggle with confirmation bias, and one of the things that attracts me to PROMS is the data that we acquire, and I think we learned a huge amount about this yesterday, and this was really really nicely summated by Joanne at the end of the day. But we talked in detail about how to get hold of the data from the Cosmin group in particular, who talked to us about the acquisition of correct patient-reported outcome measures and how we can utilise the Cosmin group and the ICHOM standard sets to really assist in that. And I learned a lot about the Cosmin review database, which I didn't know existed, and the use of the search filters. That's something that I'm definitely going to put into my research as time goes on. We also learned a lot about cross-cultural validation and how that really is vital in getting hold of the correct data. And there were some fantastic pieces of work in the breakout groups looking at cross-cultural validation in huge sections of the international population. Once we've got that data, we learned a lot yesterday about visualization and the rapid production of data outputs and how that is really vital, and the interpretation of that data is really vital in moving things forward. But as Hamish pointed out right front and centre at the start of the session yesterday, ultimately we're looking at value. And our aim is to get the best possible outcomes for patients and populations from the resources we have available to us. Next slide, please, Gareth. So I think it's good to have a little orthopaedic anecdote in this session. So this is Ernest Amory Codman, who was quite a famous orthopaedic surgeon in Boston in the early 1900s. He was a real public health pioneer for those that aren't aware of him, and he studied hospital outcomes to determine how they could be improved. And Codman quite famously wrote that he believes that it's the duty of every hospital to establish and follow up patients so far it is as possible that their results in every case will be available at all times for investigation by members of staff, trustees, administrators and authorised investigators and statisticians. What's interesting is, although Ernest Amory Codman put this into his practice, is what happened to him after he mandated this in his hospital. He was roundly derided and driven out of Boston Hospital and really struggled to practice for the rest of his career. I really think his manifesto is something that we have now integrated into our healthcare systems. I think moving forward, we're in a much better position. But these are old ideas, and a patient focus is something that should have been synonymous with all of our practice from time immemorial, but it's something that really we're only just getting to grips with now. Next slide, please. Something that wasn't really mentioned yesterday that you just want to highlight is the Baroness Cumberledge report, and this came out essentially during COVID, and I think it's been slightly lost, but I think it's something that we should all be aware of, because I think it's really going to impact outcome measurement going forward. So Baroness Cumberledge was asked to do a report following the debacle following vaginal mesh and sodium valproate. And what the conclusions that she came to were that innovation in medical care has done wonderful things over the years, but innovation without comprehensive pre-market and post-market surveillance and long-term monitoring of outcomes is quite simply dangerous. Now, I know that in orthopedics, this is already starting to impact our practice, and we are already being told that for our favourite piece of shiny metal, outcome data and PROMs is going to become very important as time moves on. But we've got to make sure that data is captured in clinics, and we've got to encourage people to complete their follow-up questionnaires. And as we all know as PROMs researchers, that is something that is becoming very challenging. But I think we've seen some great examples of ways to get around this, ways to make sure that our data is both recorded and utilised. Next slide, please. So to put things into focus, put it under the microscope from yesterday, I think we covered an enormous amount of ground. We looked right front and centre with Sally's opening remarks about how we really should be focusing on the translation of PROMs into direct care. We spoke a lot about the importance of value, and Hamish spoke extensively about this. This is value for both the patient and the healthcare organisations that we work with. Encouragingly, I think there was a patient-focused every single talk that I witnessed yesterday, both from the seminars, but also from the breakout sessions. We talked about integration and embedding PROMs into our direct care, and there was a wonderful session in the middle of the day about this. And within that, we talked about digitization and visualization. How we represent that data is absolutely vital. We talked about unification of measurements from the Cosmin group and how really best practice would implore us to measure the same things at the same time. There was some fantastic evidence of cross-cultural validation. Particularly like to point to James's work, who looked at cross-cultural validity across, I think, over 22 countries, which is an incredible piece of work. And Mel Calvert spoke to us about the importance of considering the ethics of PROMs data collection and how that should really be a future focus for us all. But ultimately, I think my take home from yesterday was that there is advancement. There's an incredible amount of effort and energy being put into PROMs data collection and advancing this area of science and area of patient improvement. So I'd like to thank every speaker yesterday for their input, their involvement. I think the questions were fantastic, and I hope that we can carry on that for the rest of this afternoon's sessions. So I'm just going to hand over to Grace now, who's going to talk to you a little bit more, and then we'll let you have that extended coffee break.
Hi everyone, John, thank you for that really excellent summary, and we've got another absolutely outstanding programme today, which I'm really looking forward to. So I'm Dr. Grace Turner, and I'm the Co-Deputy Director of the Centre for Patient Reported Outcomes Research at the University of Birmingham, which is led by Professor Mel Calvert. But I just wanted to briefly talk to you about ISOQOL, which is the International Society for Quality of Life Research. So ISOQOL have an annual meeting in October every year, and normally that's alternated between being hosted in North America and in Europe. And this year it's really exciting that it will be the first face-to-face meeting since the pandemic, which will be in Prague, which is absolutely fantastic. ISOQOL have a number of different special interest groups, which I encourage you to go and have a look at. So, for example, there's one for industry, one for clinical practice, mixed methods, and there's also a number of country-specific special interest groups, one of which is our own, which is the UK and Ireland SIG. And we met this morning at 10 o'clock. It was really great attended, and thank you everyone who joined us. So overall, really, we just want to bring together people with an interest in patient-reported outcome measures and quality of life in the UK and Ireland, and actually internationally as well, and to encourage those collaborations and networks. So we meet annually at the ISOQOL conference, so really exciting that we'll be able to do that face-to-face in Prague. And we've also started to meet at this conference as well, which has been really amazing and has been working. We do a couple of ad hoc meetings throughout the year, which tend to be themed on a specific topic. And we've started to put together different lists of resources. So, for example, Tim put together a really great list of different training opportunities related to proms in the UK and Ireland. And John and Tim have been putting together a document of different groups doing proms research in the UK and Ireland. So really useful resources available there. Another thing just to briefly mention is that we are, so the SIG is led by 3 people. So there's the chair, who's John currently, the incoming chair, who's Tim, and then myself, who's the past chair. So we're currently looking for calls for the next chair for the UK and Ireland SIG. And the deadline for that is around the end of June, I think. So if anyone's interested or wants any more information, please do let us know. And as I said, we had a really fantastic meeting this morning, which is focused on equality, diversity and inclusion in collecting patient-reported outcome measures. And we had a fantastic talk from Dr. Amita Rector, who's also speaking in the parallel sessions later on. So I encourage you to view her talk if it's a topic you're interested in. But there were some really practical and pragmatic suggestions of how we can address what is quite an overwhelming topic, whether that's related to research, clinical practice, other areas of collecting proms. So thank you everyone who joined that useful discussion. And as a SIG, we'd really like to facilitate those ongoing discussions and sharing of best practice and examples. So I won't go on any longer. I encourage you to get in contact with us and engage as much as possible. We've given you the gift of a bit of extra time because unfortunately Liz can't join us today. So that is a valuable gift and I won't keep you any longer. But as John said, I really do encourage you to take that time to grab a coffee, go and have a look at the posters rather than just checking your emails, and maybe go and make contact with some of the people that you saw yesterday virtually, met at the SIG this morning, or other people that you can see on the delegate list that you think really could be useful as part of your network. So thank you everybody. We'll see you all again at 1 o'clock, and if you just use the links for the individual parallel sessions, and we'll see you later on. Thank you.